You're listening to On Air with EUFOREA.
Hi, everybody. So we're on air with EUFOREA. My name is Elizabeth von Staeyen. I'm the Scientific Communications and Advocacy Manager here at EUFOREA. And I'm joined today on the occasion of our third annual Global Chronic Rhinosinusitis with Nasal Polyps, or Nasal Polyp Syndrome Awareness Day, by Sanaz Eftekhari. Welcome, Sanaz.
Thank you.
Sanaz is Chief of Business Development and the VP of Research at the Asthma and Allergy Foundation of America. So thank you so much for joining us, Sanaz. We're so excited to have you here.
Thank you for inviting me.
So she and I were just talking about how we both have a fear of public speaking. So what a perfect opportunity for both of us to talk about what we're doing this year. So Sanaz, so you were talking a little bit, we were speaking a little bit earlier about how in the U.S. there's not really a dedicated group for nasal polyps. So what can you tell us about how AAFA, I should say, is managing patients with CRSwNP in the context of asthma and allergies?
Yeah, of course. So because there's such a big overlap with asthma and allergies, naturally, we as a patient organization are a great fit to support people who have CRS with nasal polyps, but there really isn't a dedicated group in the U.S. So we get a little creative and we try to reach out to the folks in our community who may have these comorbid conditions with nasal polyps as well.
So what kind of resources do you think have been really helpful to you? I know EUFOREA, we're always trying to work on ways. So we have CME accredited activities for healthcare providers. We have resources for patients. We're working on a patient guide for nasal polyps that we hope kind of takes away the mystery from going and getting a diagnosis to understanding what the treatment options are. I know in nasal polyps, we're always talking about, surgery always kind of seems like it's the first option, right? We hear a lot about surgery, but we also want to talk a lot about those lifestyle measures that people can be doing to improve their care, and about the availability of biologics too. So what kind of resources have really worked for AAFA in terms of patient education?
Yeah, I think we might be on a parallel track, although EUFOREA is a little ahead of us in the U.S. when it comes to nasal polyps in particular. But we do a lot of education, both for the patient's caregivers as well as for the healthcare providers, so through CME, but also through patient programs. We're also developing a guide that's going to be taking insights that we learned from different surveys and research and interviews that we've done and building the patient guide out of that. We are taking a lot of lessons learned in other conditions that are more prevalent in the U.S., like asthma and allergies, and kind of taking the resources and things that we've developed on that side to apply to some of the other conditions that we serve as well.
I think that's really interesting. I think there's kind of been this history of HCPs only listening to each other, or there's this perception of that. So I think it's really interesting to have this kind of new perspective of really listening to the patient voice and not only talking about disease burden, but really having patients have this really empowered role in their own decision making in terms of their care, and being able to initiate those conversations with their HCPs. So you were mentioning, so AAFA is going to be doing some work in the context of the Global CRSwNP Awareness Day. What can you tell us about that?
Yeah, we conducted a needs assessment for nasal polyps, really just to get a sense of what AAFA as an organization should be doing to serve our community. So it's not going to be an end-all, be-all for all things nasal polyps, but it's taking direct feedback from our community and using that to develop our programs moving forward. And then going back to what you were talking about with, physicians talking to each other, one thing that really came up, obviously in our research and in the literature as well, is that patients really have a need for the primary care team to be more aware of polyps and really help support the patient through that process. So I will say a lot of our CME is targeted to the specialist, but we are also doing a lot for primary care. And we have this version of CME called the patient tether, meaning we bring in the patient voice and the patient vignettes into the programs that we do for the healthcare professionals, so that the panel, talking to the doctors isn't just other doctors.
Mm-hmm. How exciting is it? So we really look forward to seeing what your team is doing, and we are so grateful for your partnership. And because I think as professionals in advocacy, I think one of the things that we all see is that we can't do it alone. And we all, at the end, share the same vision. So we're so happy to have you, Sanaz, and we really appreciate your support.
Thank you.
Thank you.
This was brought to you by EUFOREA, inspiring the future of respiratory care. This podcast was supported by an unrestricted educational grant from Sanofi Regeneron.